So, my name's Vasso Apostolopoulos. I've been at RMIT for the last 6 months, and before that I was at every university you could think of. I've been at. So I'm going to talk about healthy lifespan and chronic diseases. Is basically what my program is and what I work on here at RMIT. So basically what this means is what we work on is on 5 different areas. And I'm going to go through each one of them really briefly, what we do. But then that's all good, what we do. But what about our health and well-being, like as a staff member, as our staff? How do we take care of our staff? What's out there? What can we do? So the first thing that we do in the lab, in this program that I run, is if you talk about health and longevity and aging diseases, etc., you need to first understand the mechanism of disease. How do these diseases, or any disease, we all know about all these diseases, but what's the mechanism? What is it that's causing the disease? What's a mechanism of disease, basically? So we do a lot of that type of work to try and understand what are the mechanisms, what's causing the disease. If you understand what causes the disease, then you could develop effective drugs and therapeutics and prevention strategies. So that's one. So we do have 5 different areas. The next one is, so you understand the mechanisms of disease, you've got some models of that you work on, and you say, okay, this is what happens. The next step is we work on drugs and vaccines and immunotherapy. So by understanding how disease occurs, we then develop treatments to prevent, or preventative, or for therapeutics. A lot of the work we do, we work on, the whole team works, there's a big team that we have of different students, different staff, working on cancer, on cardiovascular diseases, on autoimmune diseases. More recently, we've been doing a lot of work on infectious diseases and all these viruses and what happens to the body. We do not only work on developing drugs, vaccines, we also look at some natural bioactives, because a lot of the natural products have some therapeutic benefits. But you have to take in consideration, because something's natural, it doesn't mean that it's without side effects. So you have to be careful. So we do the scientific evidence behind a lot of these natural products and what they do. And a lot of them we have found have anti-cancer properties, have beneficial for the neurological system, etc. So we also look at some bioactive means natural products and the active ingredient in that. So in today's world, you can't not do research without including new technologies. Otherwise, we fall behind. So technology in the medical field is advancing in a very fast pace. So we do quite a lot of work in AI at the moment, because that's everything. A lot of the research is based on AI, and we sort of are keeping up with the AI research and trying to use AI to progress with our research. We're looking at prevention of falls in the elderly. We're looking at early detection of cognitive decline, like dementias, etc. So, and we're also using other technologies such as light therapy, or using these light sources, where we could use that to treat certain diseases. So we're also working on a lot of medical technologies. And the last area is we do a lot of work with engaging with the community for health. So for example, we do community health research, where we're looking at the older individuals from different cultures to try and understand the needs, the barriers they're facing, etc. So we do quite a lot of work in the older communities. We're also interested in, we're doing a lot of educating the people. So if you haven't education and understanding about your health and what's required and what's good and what's not good, a lot of diseases can be prevented. So we do a lot of education, educating people of all ages, okay? And also, you know, we developing some wellness programs tailored to people with specific diseases and the aging population. We've done some work with the Burmese community, for example, where we looked at their needs and the mental health issues and how can they be helped. Looking at cardiovascular diseases in the African community, because the Africans that come from Africa to Australia, once they get into the Western lifestyle, they're 10 times more likely to get a heart attack or suffer from a cardiovascular disease compared to a non-African living in Australia. So we're trying to understand, is it the genetics plus the lifestyle change, or what is the issue? So that's all good. That's the 5 different areas that we're working on, and each one I could give you a 1-hour presentation on each area. But that's just a bit of an overview of what we work on. We're also working on pandemic preparedness, and just there's a lot of viruses out there now that are re-emerging, a lot of new ones that have come up that we're trying to understand. You know, if there's a point where they mutate, a lot of the viruses and pandemics happen from animals to humans. So the animals are monitored, and there becomes a point where the virus mutates enough time for it to then be infectious in humans. Aging at home and aged care, we do quite a bit of that work. There's just a bit of lifestyle medicine is an important factor where we should also consider, where quite a lot of work is being done in walking, efficient diet, but also sleep is important. Studies have been done where we've done some studies where we look at people that work at night and they're sleeping during the day, the whole circadian rhythm changes, and then the whole immune system changes, and they're more prone to having diabetes or heart disease, etc. Adequate sleep is important for health. Social connectedness, social networking is very important, because loneliness has been found to people that are lonely are more prone to having sicknesses. Light exposure is important, and we also do some work on education, etc. So that's all good, but what happens, that's all the type of research we do in the program that I run at the university. That all sounds all good, but then what happens to our staff, the staff that are doing all this research? What can we do? Like, what happens? How can we help them? For example, there's, you know, when I came here this morning, I came to Balba Central, and I walked through to get out of Balba Central. There was all these shops there, and people are in there working from early in the morning till the time they leave and go home. It's dark again. They have had no exposure to air, because it's all underground. They've had no exposure to the sunlight. It's just crazy underground in the Melbourne Central. So, you know, then we wonder why we get sick, because of the environment that we're working in. So what do we do? What can we do for our staff? So one is inclusion and health. So we want to make sure, you know, they're mentally, inclusion health improves the mental health, and it reduces burnout of our staff, because if the staff is overworked and there's burnout, then nothing will happen. Sustainable design, you know, it's now thinking about having green spaces, or when we have meetings, you know, we go from one meeting room to the next meeting room, to a Zoom, to a Teams meeting, etc. Again, we're not doing much. So we're starting to introduce now walking meetings. So we go out and walk as a group, and we meet. We have our walking meetings. Or we go to the gym down at the Bundoora campus. We all go on the stationary bikes, and we're having our meeting while we're on the stationary bike. So we have to have more about what can we do to help us while we're working. Because we don't want to get burnt out, and also we need to keep happy, take care of ourselves, so then we can work more efficiently. And there's decreased chronic conditions. Healthier workplaces are important. Again, that's what I said, walk and talk, meetings, access to the gym, education to staff, etc. And also innovation to support health. So, we've got this program going on where we've got everyone wearing smart watches, and we say, okay, who's going to have the most steps by the end of the week? And we try to encourage everyone to have at least 7,000 steps a day, sometimes 10,000. When you're at the work, from meeting to meeting to meeting to meeting, you're lucky if you get 200 steps a day, because you're just sitting from one meeting to another, especially people working from home, we're just on their computer. So, we have these challenges, and then there's, who can walk the most, a fitness app, and you provide these to our workforce. That's good. What can we do? That's what we could do for our staff that are working and doing all that research, but what do we do to help the environment, have a more pleasant environment? But I'm working from home, yeah. But what we need to do is we need to talk to the government as well to help with all this burnout and stress and mental stress that people are facing. And one good idea which is being implemented in Finland is they have 4-day week. They only work 4 days a week. They have 3-day weekend, and they have the lowest mental health issues in Finland in the whole world. So they work less, but they're actually more productive, and they have less mental health issues. So maybe something like that we could consider. Working from home has been something that through the lockdowns and that has sort of introduced into our lifestyle, but it's good in a way, but it's also, you lose your social connectedness, and also you're not moving. Because, when I work from home, I'm sitting on a chair all day, and I log out, log in, log out, log into another meeting. So, and I'm lucky if I, go to the fridge, come back, go to the pantry, come back, go to the bathroom. How many steps do I do a day? Not much. So, we need to think about how we could have a healthy workforce.